not so much the screen itself that causes the damage. So people have this misconception that it's the UV light that comes from the screen or the light that causes the damage, but it could be anything. Even if the child is reading a book, holding it really close to the face, it can cause the same kind of damage because the distance actually matters more than the screen itself. So let's say one child is holding a phone. It's a small screen, they have to hold it very close to their face and do the work for long hours, right? Entertainment while feeding, whatever. Another child sees the same number of hours of screen time, but is seeing it from a TV at about 7-8 feet away. Child A is going to develop myopia just because of the near work. They're concentrating on a small screen so close to the face, while child B will be absolutely fine. It doesn't cause myopia progression if you keep the screen far away. Okay? It's important to ensure the distance is correct from the child, whether they're watching a screen, reading a book, playing with toys. What parents need to avoid is keeping something very close to the child's face. That's more important than the screen itself. So in adults, the issue with screen time is that it's so engaging. When you're concentrating on something interesting, you forget to blink. So when you forget to blink, your normal blink rate is about anywhere between 15 to 20 times per minute. And when you're watching something, you subconsciously forget to blink. The blink rate comes down to about 5 to 6 times per minute. That's about 1/3 of your normal blink rate. Why is blinking so important? Every time you blink, there's a muscle around the eye which contracts. This contraction squeezes the tear glands and secretes the tears. So every time you blink, it's like a flood of tears comes on the surface of your eye. It keeps your eye nicely moisturized. When you don't blink, that film of tears on the eye, it breaks up. So there's a lot of dry spots, and the light that's entering your eye, the tear film is the first surface that the light hits. So it scatters if it's not a clean, smooth tear film. So it causes blurring of vision. So it's not that you're going blind or you losing your vision. Your vision does become blurry if you watch TV for a long time just because of the dryness, because you've forgotten to blink. Look, everyone's on their phone these days. We call this computer vision syndrome, and we used to call it a problem of IT professionals. But now everyone's on their screens. You know, whether you're a software guy or not, we're all on our screens all the time. So our screen exposure, like I said, it's more about the eye strain and the dryness. So the 20-20-20 rule, what it actually does, what the rule is that every 20 minutes you need to take a break for 20 seconds and look at something 20 feet away. Looking at something far away relaxes your eyes. Always remember that when you're looking at something nearby, your eye muscles are contracted. It's like you won't really feel it. It's something happening internally, and it's very easy, to be honest. If I ask you to go to the gym and pick up a 1 kg dumbbell, you'll say, what, this is so easy. But if I ask you to hold that for 8 hours, your arm will fall off. It seems very easy, but 8 hours later you have a headache. What looking far away does is it relaxes those muscles and it gives you a break. So if you take this break every 20 minutes, your eyes will not be strained. And in that time of 20 seconds, we ask you to blink as well. This again replenishes the tear film, the dryness comes down, and you'll be much more comfortable. So it definitely works. Myopia is an epidemic now. Almost 1 in 3 school children has a minus number and requires glasses for it. So it's a growing issue, especially in India and in Asian populations. It's very rampant, and that's only going to increase in the next few years. This myopia needs to be controlled at a very young age. It can become progressive. Progressive myopia is the number that goes on increasing without stabilizing or stopping even after a certain age. In younger children, you can have myopia, myopic astigmatism. It's important to get the checkup done early so that you have a baseline, so that you can compare it to the next checkup and see whether there's any increase or progress. A lot of parents do miss the signs of myopia, and this is what is dangerous. If it's diagnosed and if the child starts wearing glasses, it's actually quite safe because every year you get the checkup, you know what's happening, you know whether the power is stable, whether the power is increasing, and you can control it. Now we have so many ways to prevent the myopia from increasing and to control it. But the main thing is that first visit, that primary diagnosis, which most parents miss. They have this mindset that if I go to the doctor, they'll say something is wrong. So they just avoid even coming for a checkup, and that mindset is really dangerous. They don't want their young child to have glasses. I completely understand, it's not nice. It's like an accessory for the child. They may get bullied in school, they may not able to play sports, but you have to understand that for the child to see clearly, it develops their personality. A child who's not seeing well for distance will not get into sports. They'll become a bookworm. Their whole personality and their whole world will develop just 10 feet around them. So this is unfortunate, right? Maybe that child has a potential to become a football star if you corrected his vision, right? So always get it checked. Whether it's possible to get it corrected or not, it's possible to control it. At a young age, what does correction mean? The only option for children is glasses. We give them glasses initially and their vision as such will get corrected. Important thing to note here is that if they're seeing clearly, the rest of their eye, the retina, it's developing normally. What happens if you don't correct it? The child's vision is blurry, and up till the age of 6 only can the retina develop. In case you don't give the child the glasses, and especially if they have power only in one eye, then the brain stops using that eye. It ignores the image coming from that eye. So it becomes a lazy eye. So you develop something called amblyopia, and the eye can become a squint eye also. Now, if this is not corrected by the age of 6, then this eye stops seeing well for the rest of the child's life. So that is really worrisome and it's dangerous, because if you leave it alone and it's not corrected, the potential for vision is also not there. In future also, we can't do LASIK to correct this. If the lazy eye or the amblyopia sets in, we cannot do anything. So you need to correct it when it can still be corrected. That's before the age of 6. Yes, you can correct it before the age of 6. If it progresses beyond that and the child is not wearing glasses, high power, single eye has a high power, then there's a chance that it cannot even be corrected in future. So this depends on the birth, right? If the baby has been born on time, then it's fine. If the baby is premature, then your pediatrician or the NICU itself will have an ophthalmologist come in and check the child's eye for the normal development. There is a chance of developing this condition called retinopathy of prematurity, where the retina doesn't develop normally in premature babies. So in case the baby has been born earlier than the expected date, then it's much more important to get the eyes checked regularly, even at birth and after that. If the baby has been born normally, then initially in the first couple of years, there are only very few things that we can check. We can check if there is any squint, we can check if the child is fixating on an object, if the child is recognizing the mother. So these are all signs that parents can very easily look at. The first eye checkup should be done before the age of 3. That's when the child can recognize figures, an apple or a ball or this or that. So we can roughly judge the child's vision, fixation and all. So by 3 years, we can do a thorough checkup, ensure that the child doesn't have any power, doesn't need glasses, and the eye is developing normally. After that, every 2 years is important if the child doesn't require glasses. But if the child is diagnosed with myopia and has glasses, then every year it's important to get the eyes checked. So what should parents look for in their child? If the child is keeping anything way too close to their face to see clearly, that's one major sign. If the child is trying to close one eye and see only with one eye, that's a major sign. If the child's eyes are crossed or squinting, and you may only see this in photographs or when the child is a little sleepy, then please bring them in. Even blinking very frequently, squinting at objects to see, these are also signs that the child might have myopia. And slightly older children will complain about having difficulty seeing the blackboard. Sometimes teachers may even say that the child doesn't pay attention in class, they have ADHD or something, but it may just be eye power, right? So it's not that they're distracted, they just can't see the board. So that's another thing. And if the child is only interested in near work, very interested in books and the close by toys, and is not really going out or playing sports or having outdoor interactions, then just get the eyes checked, because it may not be a personality trait, it may just be a glass power. So if you're noticing these things in your child and you have questions and queries, don't go to ChatGPT. Come in for an eye checkup, because we do a comprehensive examination. It doesn't have to be filled with fear and questions. Things become very clear and easy just with a single eye checkup. Doesn't have to be complicated. Please bring them in and we're there for you.